This week's critical thinking is on cardiovascular anatomy and circulation. And let me show you the questions first. So this is about something to do with the borders of the heart. The next one is on the valves and the cycle, the cardiac cycle. This is on septal defects. This one has to do with something in the cavity, in the left ventricular cavity. Then these are questions on circulation. The next one is on circulation of the uterus. And then this is on the aortic arch. Let's now go back and look at the correct answers. So the first one was this. The radiologist's report mentions that the inferior border of the heart has shifted and lies lower than normal, indicating that certain chambers are enlarged. Which chambers are involved? So for this, you must know how the borders of the heart are formed. So if you look at it this way, this is the right border, this is the inferior border, this is the left border, and this is the superior border. So the right border is entirely formed by the right atrium. The inferior border is formed by the right ventricle and the left ventricle, with the left forming the apex. The left border is the left ventricle and a part by the left auricle. So this is the left auricle. And the superior border by the right atrium and mainly by the left atrium. So both atria, but the left taking a greater part. So it tells you that the inferior border has shifted and lies lower, indicated that chambers have enlarged. So if this border is lying lower than normal, so these are the chambers which have enlarged. So that means the correct answer would be the right and left ventricle. So that's how you've got to kind of relate what the correct answer is and think analytically on this kind of question. The next one, it tells you that the mitral valve is narrowed and this will cause problems in blood flow from, and you have a lot of choices. So first, in the cardiac cycle, you must first kind of in your mind think of the mitral valve is an atrioventricular valve. Now in the cardiac cycle, blood flows from the atria to the ventricles. It's a one-way flow. So let's look at some choices which we can right away do without. The blood does not flow from one atrium to another, so this can be discounted. It does not flow from one ventricle to the other. Now, as I said, the blood flows from the atrium to the ventricle. It's a one-way flow. So anything which is the opposite, which is from the ventricle to the atrium, can be discounted. So this one is not taken into account, and neither is this one. And then now we have these two. So in this is the mitral valve, and it allows blood to flow from the left atrium to the left ventricle. So if it were narrowed, it would cause problems in flow from the left atrium to the left ventricle, and hence this is the right answer. So that's how you must think and how you can immediately remove some of the choices and then, come down to a couple maybe and then choose between them. Let's go to the next question, which asks you whether septal defects will cause conduction problems. And this is another kind of question where I've again put images to show you how you must look at these images really carefully, because some of these questions will ask, the questions are based out of the images, so they may not be written in your notes. They're possibly mentioned in the narration, but you must think critically for yourself too. So now look at this. This is showing you the conduction system of the heart, and here you can see the AV node being very close to the interatrial septum, and here is the bundle of his, and then the two branches again lying in the interventricular septum. So therefore, if there is a problem in the septum, if there's a defect, if this area is damaged or this area is damaged, any part here, it will cause conduction problems. So the answer is true. So here I'm trying to show you how you must look very carefully at the images. Now let's look at this one. So here it tells you that there is a tumor which is growing in Tim's left ventricular cavity. Now this is this image is there in your PowerPoint slide, and this is the left ventricular cavity. And let's say we have a tumor growing here. We don't know where it's growing, but it's inside this cavity. So it says it could involve all of the following structures except. Now in the cavity, this is the mitral valve. So the tumor could involve this mitral valve. Aortic valve, here is the aortic valve. If the tumor grows, it could involve the aortic valve. The interventricular septum. The interventricular septum lies here in between the right and the left ventricle. So if it's growing, it could involve the interventricular septum too. Small cardiac vein. Now the small cardiac vein is a vein on the external surface of the heart and on the right side. So it lies along the right border of the heart. So I should really be drawing this in blue. So this is one structure where this tumor which is lying inside the cavity will not involve. So it won't involve the small cardiac vein. And let's look at the last choice. Let's not stop there. Let's see. Will it involve the chordae tendineae? Yes, see, these are the chordae tendineae attached to the mitral valve. So it could involve the chordae tendineae too. So you can see from this, the correct answer would be that all would be involved except the small cardiac vein. So that's how you're going to be answering questions of this nature. Let's look at now questions on circulation. So here it says blockage of the axillary artery will prevent blood from flowing into, and let's say this is up here is the axillary artery. So let's say the axillary artery is blocked here. So blood now cannot go down. So it cannot go into the brachial artery because after the axillary, the next artery we see here is the brachial. So this is the right answer. Let's look if all of the others. So don't always, the moment you reach the right answer, don't kind of discount all the others. You must go through all the choices first and see which ones you can discount and which ones then you say are definitely correct. Now, can it prevent blood from flowing into the subclavian artery? No, because the subclavian artery is here higher up. So blood will flow from the subclavian into the axillary. So if this is blocked here, the blood has already flowed into the subclavian, so there's going to be no blockage there. External carotid, this is up here, it's higher up, so it's not going to block blood flow into that. Femoral artery is way down here after the aorta divides into common iliac, which divides into external and internal, and then the external continues as the femoral. So this is up, from here, so it's not going to block blood flow in the femoral artery. So our first choice was correct, so that is the correct answer for this question. Let's look at the next question, which tells you that the blood supply to the uterus will be compromised if which of the following arteries is ligated. So let's now think, where does the uterus lie? The uterus lies in the pelvis. So if it's lying in the pelvis, which is the artery which supplies the pelvis? So let's see the choices. The external iliac artery, it's external, it lies on the outside and you can't see the rest of it. So this is the external iliac artery. So if I was to draw the common iliac dividing into, this is the aorta dividing into common iliac, which divides into external and internal iliac on this side. The external goes into the thigh and becomes the femoral. So it is really going into the thigh and it supplies the outer aspect of the abdominal wall, so not this. Neither would the femoral artery, if the femoral artery was ligated, it would not involve the uterus because the femoral artery is supplying the thigh. The common carotid artery supplies the neck, so this would not affect the uterus. Internal iliac artery. The internal iliac artery, which if you look here, is this tiny artery which we see. So this internal iliac artery here is the artery which supplies the pelvic organs, and the uterus is a pelvic organ. Therefore, if the internal iliac artery were ligated, the blood supply to the uterus would be compromised. And the next question, it tells you narrowing of the arch of aorta would decrease coronary circulation. And the answer is false, because if you look at from the heart, so if this is the heart and from the left ventricle, the aorta comes out. So first you have the ascending aorta, then that becomes the arch of the aorta, and then that's the descending aorta. So suppose this was narrowed here at this point. It asks you, would it affect coronary circulation? It tells you it would decrease coronary circulation. The reason it's false is because the coronary arteries come off from the ascending aorta. So this part is the ascending, and this area here is the arch of the aorta. So the arteries, the coronary arteries, the right and the left, come out from here. So blood has already flown in here and then it's going there. If it is narrowed, actually there'll be more blood here. So actually the blood in the coronary arteries would be more than normal. So it would not decrease coronary circulation. So that's the answer to this question. So I hope this helps you, and that's why I want you to pay attention, special attention to all the images in all your PowerPoint.